Hello, good evening, everyone. Today, our webinar is on clarifying your doubts regarding COVID-19. For the webinar, our guest speaker is Professor Indika Karunathilake, the President of the Sri Lanka Medical Association. It's over to you, Professor.
Thank you and good evening. And I thank the Alliance Club and the Royal College Lawyers Association for inviting me. And during this session, we try to understand the scientific basis because that's of COVID-19, because it's very important to understand the basic science, especially considering the current situation where there's a lot of misinformation is happening. Yeah, can I share the screen?
Yes.
Okay. So we'll start from the very basics. Now, this epidemic is, as most of you are aware, this epidemic is spread by a virus, the RNA virus, called, in a colloquial term, we call it novel coronavirus. Scientifically, we call it SARS-CoV-2. Why SARS? Because previously also there was a SARS virus that was detected about 10 years ago. And COVID is coronavirus because when you look at the shape, it is like a crown. And now you can look at this electron microscope based simulations of the coronavirus. Now you can see there are certain kind of material that is projecting out. So that is why it is called the coronavirus. So the scientific name is SARS-CoV-2 and the colloquial name is novel coronavirus. Sometimes you just call coronavirus, but there are many coronaviruses. Okay. And the disease is called COVID-19. So there's a difference. Disease is COVID-19. That's the WHO coined term. The virus name is either novel coronavirus or SARS-CoV-2. Okay. And it's important to understand about the structure also. Now, you can see certain elements that are jutting out. They're actually protein molecules. These spiky shaped molecules are protein molecules that help the virus into attach to certain cells, because virus can't survive, virus can't replicate without getting into a human cell. They can survive, but they can't replicate and produce more and more viruses without getting into a cell. And these spikes help to attach to the cells. So that is why it is important. And this is the virus genetic material, what we call RNA. Now humans have both RNA and DNA as nucleic acid, but viruses have either DNA or RNA. So this is a RNA virus. So this is the nucleic acid material within the virus. And these are the spiky proteins which help to attach to the cells. And all these are basically bound by a lipid layer, lipid bilayer actually. This is lipid bilayer. And this is one reason why we tell to wash hands with soap and water for 20 seconds or use alcohol-based sanitizer, because as you are very much aware, lipids get dissolved in soap and the virus get disintegrated. So that's the very reason. Okay, that's the basic science. And this virus is generally spread through infected droplets. There are two main ways. One way is through infected droplets, that's coming out from infected person. Other one is when these droplets, when they drop into surfaces, and by touching the surfaces, you might get the disease. The most important reason is through the infected droplets. Okay. Then let's try to understand what happens after this. Again, this is very important. I'll try to make what is complex as simple as possible. Now, as you are very much aware, this is the virus. These are the glycoprotein, the spiky proteins, and this is the RNA. Now you can see this is a cell. This is a representation of a cell. Now you can see these spiky kind of molecules are binding to a receptors within the cell. So that is how it gets in. And then it gets into the cell. Once it gets into the cell, the RNA gets released, and some of you have the biology understanding or the experience, expertise, you would know that this RNA gets replicated, similar to the DNA replication. And then it becomes more and more new viruses and release. So this is how the viral replication happens within the body. Now, this tells us something important. These viruses, initially through droplets, get into the upper part of the human respiratory tract. But when these viruses get into the tract, they don't stay there in that lumen for long. They get into the cells. Okay, this explains us something. Now there is a conception that by drinking hot water or steam inhalation, you can kill the virus. Now, when you have a respiratory illness or symptoms, drinking hot water or steam inhalation will give you relief. That's correct. That's proven scientifically also. But now you can see that it will not be able to kill the virus, because no sooner the virus gets into our respiratory tract, it has to attach into a cell and get into a cell within the cell. So this means if you are to kill the viruses, you have to kill our cells also. And it's not practical. However, this explains how the virus gets into the body, and it replicates. It replicates and go down the respiratory tract and reaches the lungs also. Okay, then what happens? Now this explains. In the droplets, get into the respiratory tract, into the lungs. And this is a diagrammatic representation in the graphical form. Once the virus gets into the body, initial few days, there is no symptom at all. Okay. Symptom starts in day 0. And initially very mild, moderate illness for about 10 days. For most of the people, they stop at this level. About 85% is mild or even asymptomatic. Okay. So the initial phase is after the infection. After the infection, it takes some time to get the infection started, which we call the incubation period. It can be as short as 2 days or as long as 2 weeks. After that, there's some time till the symptoms start. And then the symptoms start, and most of the infected, they remain asymptomatic or mildly symptomatic. Very few, about 15%, move into severe illness, and even less move into critical illness. Okay. So this is the general timeline of the disease. Infection, incubation period, pre-symptomatic, and mild or severe symptoms, moderate symptoms starting, and moving into, for very few people, severe or critical life-threatening illness. So this is the general timeline that we are talking about. This is further explained here. This is a time from the infection, and this is the severity of the illness as time goes on. Initially, the viral response. And what happens is, when the virus gets into the body starts fighting against that. The body produces various cells and various material to fight against the virus. But that's a severe fight. That is what we call the inflammatory response. And that is why we get fever, pain, redness, and all other symptoms. Because of this inflammatory response, body starts fighting, and because of the fighting, we get the symptoms. And because of this fighting, some damaging things can also happen, because all these substances that are meant to fight the virus sometimes can cause or impact on other systems as well. That is why we get the symptoms like fever, so on and so forth. So initially, very mild illness, okay, low-grade fever, dry cough is very common. Sometimes they might get diarrhea, depending on where the cells go and attach. Wherever those receptors are, cells go and attach. But generally, more often than not, it will be the respiratory tract. And during this time, blood counts might change. As time goes on, when the host inflammatory response starts, there can be shortness of breath and moving into severe illness. So these are different phases of the illness and different management options. Okay. Am I clear up to this point? Okay. If you find any difficulties, or if you find it too complex, you can ask me. So this shows the disease progression and different symptoms. and maybe different drugs that can be used at different time points according to what happens within our body. Okay. Then what about testing? Now the virus gets into our body and the protein is called viral antigen. Initially, very small amount because only few viruses get in. But as time goes on, as I have mentioned previously, viral replication happens. Viral replication happens. Then what happens? Our body start the fight. And the main fight is again through a protein called antibodies. So this is how the antibodies are starting. Okay. When the virus gets into the body, the virus releases, within the cells, the virus releases their genetic material, what we call RNA. Okay. So as the virus gets into the body, viral antigen increases and viral RNA increases. It goes up because the viral is replication. Later, when the disease is subsiding, the amount goes down. During this time, our body starts the response. This is where the antibody starts. Okay. This tells us few things. One thing is all of you are familiar about the RT-PCR. PCR is what we call polymerase chain reaction. It is a biomolecule test which can detect the existence of viral RNA. Again, mind you, it can detect existence of viral RNA and not just the viral, not the virus. To detect virus, you have to do viral cultures. And the facilities available in Sri Lanka are not adequate. But PCR test can detect the existence of viral RNA. At the same time, antigen test can detect the availability of the viral proteins. That is what we call the antigen. Antibody test can detect the existence of antibodies within the body. So this tells us something. If you want to detect the illness early, what should be the test? Or what are the tests that you should be doing? Is it antibody test or PCR test? If you want to detect early, what should be the test that you should be going for? Any idea? Okay, some of you are muted. I can't hear. Anyhow, if you want to detect early, now you can see, if you want to detect early, then you have to do PCR. Early detection is very important because if you leave the patients in the community for a long time, they will go on and spread others. So worldwide, the gold standard for diagnosis is RNA. Gold standard for diagnosis is RNA. For a particular time period, you can use the antigen test also. But now you can see that antibody testing doesn't help us to identify those who have the disease early because it takes at least 2 weeks for the antibodies to develop. Therefore, if you want to detect the patients early, we have to go for RT-PCR. Again, it's a very complex test. It's a biomolecular test where the material is taken from the patient's nose or upper respiratory tract, and those material are later extracted, and then RNA is amplified, and those amplified RNA is detected through a complex system. So it's very expensive, very time-consuming test, which needs a lot of expertise. In the antigen testing, is simpler, where again material sample is taken from the respiratory tract and the existence of viral proteins are detected. It's like the strip test that you use for maybe for diabetes or pregnancy. The strip test give a color change. Here also the strip test give a color change related if the antigens are positive. Antibody test is a blood test. But now you can see, if you want to diagnose early, you have to go for RT-PCR. If you want to detect someone is infective, you have to go for antigen. So this is the general pattern. Again, I hope you have understood this clearly. And if you have any clarifications, I am ready to make it. right? So I'll be moving in. So this is about testing. Now this too also the same diagram. Once someone gets the disease, what happens to the viral load? It increases. Why? Because the virus is replicating and it goes down. Now you can see by using PCR, you can diagnose even when the symptoms are not apparent. Okay, very early. And it goes on sometimes little later also. Because as I have mentioned, PCR detect the existence of viral RNA, not the actual live virus. So sometimes when the virus goes down, when the patient ceases to be infective, still PCR can be positive. Okay, so PCR can be positive. That's why in the past, it was mandatory to have 2 RT-PCR negative before discharging. But once these results, the research are available, because as you know, this is a new virus they are discovered only 1 year ago. So the information is slowly emerging. Recently, it was discovered that PCR positive does not necessarily imply infectivity, because it just shows the existence of the viral RNA and not the live virus. However, if you want to diagnose someone at the early phase, PCR is very important. If you want to find out whether someone can spread the disease to others, antigen testing is also adequate. Okay, so for diagnosis, ideally PCR. But certain situations where there are a lot of people are affected, and if you want to find out someone is infectious, antigen test is okay. Less expensive, less costly, less time. Those are the two main tests to diagnose and detect. Okay. Again, I think it's clear up to this point. Now, a lot of people talk about the amount of PCR testing done in Sri Lanka. Is it adequate or not adequate? Now, you can see till very recently, till about October, the number of PCR tests were done was around 2,000, 1,500, 2,000. And later, when a lot of patients were detected, now it has gone up to 10,000, 11,000. Now you may ask, what is the adequate? Because there is a lot of pressure, a lot of kind of lobbying to increase the number of RT-PCR. One thing we need to realize is that PCR is a very sophisticated, expensive test. So you have to use it very carefully. And the country has a certain capacity for PCR testing. If the country's capacity exists, for example, during last October, the number of PCR tests has suddenly surged from 2,000 to 11,000. That was the period where the results were delayed because the capacity was beyond the need, beyond the requirement or the number of testing done. So this is something that you have to be very careful, because no point of having a delayed results, because what you want is immediate detection. So what is enough? Is 1,500 enough or 11,000 enough? Or is it not enough? Again, it's not a simple answer. It depends on the context. This is where what we call the RT-PCR positivity ratio. That is what we call the number of positives when you do 100 tests. Now, if you could see in around before October, even when we do about 1,500 PCR tests, only about 1 or 2 are getting positive. Only about, even less than 1, because the number of patients are very low. So RT-PCR PCR positivity ratio was less than 0.1. Okay. Now WHO generally recommends, if a ratio is positivity ratio is between 1 and 5. That means when you do 100 PCR testing, if 1 to 5 become negative, that's an indicator that the amount of testing is adequate. Now generally, now you can see during this time period, it was actually less than 1 point. And this surge is, if you could remember, when the branding cluster started and later fish market, these surges. But nowadays, generally, Sri Lanka's national positivity ratio is around 5 to 6. That's the upper limit of WHO. So we are generally doing okay. But again, that also varies, because if you do the test in certain areas like say Mattakuliya, then sometimes if you do 100 tests, about 15 to 20 might get positive. But if you do the same test maybe somewhere in Galle or Mathura or maybe Anuradhapura, it could be less than 1%. So it varies from place to place. One thing these situations have actually told us is the testing has to be targeted, where it is most likely to detect many patients. Again, the current experience has shown that the disease spreads very fast in the places where there is poor ventilation, congestion, and a lot of people are there, and very poor adherence to preventive measures and the hygienic measures. Generally, so lower socioeconomic. Epidemic doesn't affect everyone equally. That also affect who are socially deprived, socio-economically deprived, because these are the places with high population density, poor ventilation, poor hygienic practices, and poor access to health and poor knowledge. All these things coming together, those areas, the number of patients are very high. That's why even when you take Colombo also, there are certain areas like Modera, Mattakuliya, Padrigoda, so on and so forth. Those areas, the positivity is very high. But if you take other areas in Colombo, it's low. So that's something that you need to understand very clearly, that when it is crowded, congested, and poor hygienic practices, the spread is very fast. These are what we call super spreader events. And the epidemic doesn't affect everyone equally. Okay. Now about the vaccine. Now there is some good news coming in, that some vaccines, actually 3 vaccines at the moment, have shown very encouraging results, which is a good thing. It's a very good thing. Now, this is something unusual also, because generally development of a vaccine take about 10 years. Development of a vaccine takes about 10 years. That is with very good reasons. Okay. Yeah. How a vaccine works is, when the vaccine is given to a population, they slowly develop something called immunity. When a lot of people are not immune, when the other infected people coming in, the disease can spread. But when many people are immune, the spread is slower. When most of the population are immune, then basically the spread can be contained. This is what we call herd immunity, and this is what is trying to be achieved through vaccination. Again, how many should get the immunity if you are to prevent this? Again, there's a lot of research data arriving or appearing. Now you can see some diseases that spread very fast, say smallpox. What is meant by R0 value is how many people can be infected by one person. Generally, it has to be around 1. That's the ideal value. Then the infection is slow. But when it is around this number, then the spread is very fast. When the spread is very fast, a lot of people need to be immune if you are to prevent the infection. When the spread is slow, like here, then even with 40% population immunity, you can stop the spread. But SARS-CoV-2, as you know, spread very fast. One person can infect about 6 people. Therefore, if you want to spread the disease, stop the spread of the disease, a lot of people has to be immune. So that means no point of immunizing few people. So this is another important message that you need to understand. Now I mentioned previously, a virus takes long time. Sorry, a vaccine takes long time. Initially, molecular testing and testing on the animals, and then testing on small number of people, then phase 1, phase 2, then very large number of people, then the approval, then production. All these things takes at least about 10 to 15 years. Again, with very good reasons, because vaccine is something that affects our immune system. So we really don't know what kind of damage it can do, apart from the immunization. It can happen because we don't know what are the effects of these molecules. So that is why you have to go through these processes. First, test on molecules, and then on the rats, find out whether there are any effects on them, and then smaller number of people, and then larger number of people, and much larger sample with many countries. And these studies take several years, not because the technology is poor, but certain side effects will take time, especially drugs that are affecting on the immune system. Then only the approval, then only production. However, on emergency situations, World Health Organization and other federal and the international organizations, they deviate from this process and accelerate because it's a global need. However, the steps are still followed. Only thing is they are shortened. For example, animal testing has to be done. After that, before phase 1 finishes, phase 2 starts, larger number of samples. And then phase 3 starts simultaneously. And if the results are promising, production also starts sooner, while parallel. That is what is happening at the moment. That is why at the moment there are about 50, 100 vaccines are in a trial, and 3 have shown rather promising results. How this was achieved is by shorting. But having said that, the World Health Organization or other safety organization, they will not approve unless at least the minimal safety measures are fulfilled. And those applications are not approved yet. It will take a little time in certain countries. Now, UK has started the Oxford vaccine now. Oxford vaccine, their results are published in a research paper, in a journal. But other vaccines, their results are published, but not in a scientific journal, but in magazines and newspapers. So there are some concerns, but anyhow, there are some encouraging results as well. I'm trying to show why general vaccine development process takes time, but this has been an accelerated process. Okay. How the vaccines work is, there are two main ways. One is these protein molecules, they are taken over, and then the vaccine tries to produce antibodies against this in the body. Other way is molecules similar to this mRNA, the mRNA of the virus, and it is injected to the body so that then the proteins, spike proteins are produced by the mRNA, and the body develops its reaction and the antibodies. And then that will help the immunity. When the body has the developed antibodies, that can basically act against or fight against the disease. So there are two main ways. One is through these spike proteins and get them to develop the antibodies within the body. Other one is through the mRNA and get them to produce the spike proteins kind of material within the body, not exactly the protein, but similar ones, so that the body will develop the reaction and the antibody. And the antibody can later fight the disease. So this is how it is developed. And kind of comparison, most of the ones, they depend on the RNA type of particle, so that it will, once injected, that will start a reaction within the body, which will develop antibodies. And there is the Russian one, actually modified virus particles like that spike proteins, again to develop the antibodies. All these viruses need to be maintained in a cold chain. You can't keep it in room temperature because they will get inactive. Now the Pfizer vaccine that was developed US and the German collaboration needs 70 degrees minus. Sri Lanka at the moment doesn't have that facilities to maintain this cold chain. Other virus called Moderna said to be surviving within minus 20 up to 6 months. Oxford seemed to be the most kind of feasible because it can be maintained in a cold chain of the regular fridge. All these need 2 doses at least. All these need 2 doses. And some have been proven to be effective in 90% and 95%. What does this mean is once it is given to 100 people, about 95 people, they develop strong immunity so that even if you get the disease, they don't get it seriously. So that is how it works. Okay. Now the realities. As I have mentioned previously, for COVID-19 to have effective herd immunity, at least 85% of the population need to be immunized. No country in the world at the moment have the capacity to immunize this number, this amount, because you have to produce in very large scale, and the world has billions of populations. So the current, even in developed countries, the current decision is to basically go for identified groups, high-risk groups. For example, maybe to start with the health professionals who are mostly affected and the elderly populations and the high-risk group who will be affected if they get the disease. So that's the current situation. Yeah. And even in most developed and rich countries, it will take some time to immunize the whole population because you need to produce in very large numbers. And when it comes to Sri Lanka, it might take some time, even though UK has started it this week. When the vaccine comes to Sri Lanka, it might take some time because generally it is the richer countries who have invested on this vaccine. So basically they are getting their quotas before everyone. This is where the WHO and other UN agencies comes into play, and they have arranged a collaboration called COVAX, where they will be helping the developing countries or low middle income countries to get the vaccine. However, having said that, the country has to pay for it. And also, even the COVAX is not able to provide vaccination for the whole population because that is practically impossible at that time. And you have to make sure that you are getting 2 doses of the same vaccine. Otherwise, the immune reaction is not effective. So there are certain question marks. What I'm trying to say is having the vaccine is a good thing. Having a vaccine is a good thing. But having said that, it should not be the only solution. This is a very important tool, very important weapon, but it should not be the only solution. Because as I have mentioned, there are logistical and financial issues also. And other thing is, if you stick to the basic preventive measures, that is wearing the mask correctly, and then physical distancing, cleanliness, and avoiding going into crowded places, that's the most important thing, then you can actually increase your chance of not getting the virus or infection. And if someone is infected, the best measures is detect early and isolate. Isolate for about 2 weeks because at the time period, the person will cease to be infected. So those are the basic measures. And we should not be deviating from the basic measures. Nowadays, you may be hearing about certain miraculous treatments, so on and so forth. Again, what I have to say is, at the moment, there are no drug that has gone through the rigorous ethical and the safety precautions and the steps and shown without beyond reasonable doubt that they are effective in safely curing the COVID-19. At the moment, there is none. There's no result. There are no drugs that are available at the moment. And there are some claims that are basically unsubstantiated. I'll give one example. Now, the different syrups that is coming into play. Now, one thing is when you have a respiratory illness or symptoms, if you get anything that is sugary, that might give you some relief. You will feel better. That's scientifically proven as well, because that will coat the inflamed surface and that will give temporary relief. But there is no syrup or no molecule that has been proven up to date that will get into the cells and kill the virus. You cannot. And it cannot be proven in Sri Lanka also because, as I have mentioned previously, negative RT-PCR doesn't mean that patient has or doesn't have the disease. Because if you want to really find out whether the virus is there, you have to culture the virus. Those facilities are not available at the moment in Sri Lanka. RT-PCR just detect the existence of RNA within the body, viral RNA. It doesn't denote infectivity. It doesn't say whether the person is cured or not. So it is not a valid test. So what we have to say is, we should not be deviated by the claims regarding unsubstantiated remedies, because the most damage that I see is that will divert your attention from the from the basic measures, because a lot of work is within the community. Community empowerment plays a big role. The community should take the responsibility to the, because without that you can't maintain physical distancing, overcrowding, or the sanitation. Those measures, it's with the community. So if the community is not empowered, those measures will fail. If the attention is diverted and the basic preventive measures are forgotten, that will seriously hamper the chances of preventing this epidemic. Okay, so those are the basic information that I wanted to give you. Yeah, Savesh, I think this is the end of the presentation. If you want to have a discussion, we can start now. We have a little time for the discussion also.
Thank you very much, Doctor. Now it's time for the audience to ask questions directly from the doctor. Please unmute your mic and ask your questions. Yes, you can ask. Please unmute your mic and ask.
Or you can send in the chat if you can't.
Good evening, Doctor.
Evening.
Yeah, thank you for the very informative, very informative session about the COVID and the current situation. Just wanted to know, currently, I know there is like not a exact lockdown in Western Province, only few areas of Western Province that has been like a lockdown. And I know this is probably not what would you suggest, like for an example, now there are young adults who are going for classes because they're getting ready for O levels, and then there are groups that are gathering for the season. So because I don't see any awareness programs that is happening from the health sector or from the government. Like I don't know how we could prevent, because the more we gather, the chances of getting the disease is apparently more.
Yeah. Okay. Yeah. I think there are a lot of awareness going on. I mean, from the mass media and the health sector, so on and so forth, by giving the basic information. I mean, what you have to adhere are the basic measures, like I have mentioned previously, maintaining physical distancing, because there are all these have scientific basis. I mean, washing hands, because as I have mentioned previously, the droplets can get into the hands and from there onwards into respiratory tract. And it was shown previously, the virus can be destroyed either by soap or alcohol-based sanitizer. That is why the basic sanitary hygiene. And by wearing a proper mask properly, you can prevent the disease getting into others, so disease getting into you. And there are different types of mask also. However, some kind of mask is better than having no mask. Okay, so that's another thing. And third one is physical distancing. Again, why 1 meter physical distancing is, again, research has shown when some person speaks, then the droplets can go up to about 1 to 2 meters. But again, it's depending when someone is sneezing, it can be even further. So all these things are contextual. That's why the general message is the 1 meter. But again, the crowded places, if you are in a confined space where a lot of people are there and with poor ventilation, then again 1 meter doesn't come into play, because sometimes there can be infected droplets and they might be able to remain in the air also for some time. Yeah, I mean, there are some evidence coming now. That's why you should be avoiding going to crowded places, and if possible to avoid air conditioning and keep it well ventilation. Ventilation is the key. Hygiene, ventilation, and mask is the key. Research worldwide has shown if you go for 100% mask usage, actually you can basically minimize it to a almost negligible amount. or the proportions. Okay, so what I'm trying to say is adhering to basic measures. I don't think lockdown is the answer. Lockdown may be necessary in certain situations where it is uncontrollable, and basically to remove or isolate a larger group of people who are at risk of spreading to others for a short time period. But having said that, then you need to go into other measures. I mean, how to provide facilities to those people who are there in the lockdown, and how to do the testing, and how to do the treatment. So just looking down, it will be basically what will happen is then the disease will spread within those communities. Just imagine a slum population under lockdown. Then if the basic measures are not there, if they are not implemented, then the disease will spread within that community. So lockdown is okay. It may be necessary in certain situations, but that is not the answer. That's only part of the steps. All these are part of the answer. What is most important is adhering to those basic preventive measures. If you can do that, I think the spread can be minimized, because one reason is you can't close down the country forever. You can't lock down the country forever, because you have to get on the economic thing also. The economic process, again, what research has shown is the deprived population who are affected most. So if you go into the lockdown for a longer period, their situation too will get worse. So lockdown may be necessary, but not for a very long period. All other measures have to be there. Very important, communities has to be empowered in different ways. Education, support, testing, or maybe financial support. All these things are important, and all these are very worthwhile investment. So the key message is adhere to the basics and don't get diverted by other diversions.
Thank you, Doctor.
Thank you very much, Lion Shyama. Any other questions?
Dr.
Good evening,
Indika, I have a
Professor.
question for you.
Yeah.
Hello, good evening.
Good evening.
I just wanted to ask about the immunization. Now, my understanding about the immunization, all of it, the Cipher, Oxford, everything, that when you actually take this, there are a lot of side effects, especially this that you can be, if you have any allergy, or if you are suffering from any kind of allergy, that it can affect the immunization. The injection could affect you seriously. Is that so? Or, I don't know. I'm not sure about it. So just want to clarify.
Okay. Yeah. So this is basically weighing the risk and the benefit. Same with the vaccine. Again, having said that, I would say having the vaccine is a good thing. It's an important tool. But we should not be believing vaccine is the only tool that's available with us to fight this. Again, I'm highlighting the most important is go for the basics. Mask wearing are the basics. Yeah, the question you asked, whether will it have side effects? Any drug will have side effects. Any vaccine will have side effects. Those side effects will vary from person to person. Now, WHO or other organization will not release the vaccine without it going through at least the minimum safety regulation. Once it has to be proven. Now you may see that some of the vaccine programs are stopped because there were some side effects coming up. It's possible. And in a general population, anyway, it is possible that some people will have some side effects. It can definitely happen. So it's a risk and benefit. So once this risk and benefit is at acceptable level, then only the World Health Organization and others will approve. Once it has got the safety approval, what we can say is it is reasonably safe to take the vaccine, and the benefit outweighs the risk. The chance is there, but chance can be 1 in 1,000, 1 in million. All these possibilities are there. But it is not a reason not to take the vaccine. If the safety approval is there, you can. But my problem is not that. I mean, there are a lot of logistical issues, a lot of financial issues. So there may be some time till you get the vaccine. And how the government or the quacks can immunize the whole population, at the moment is a far target. Because no other country can do that. So it will be the initial groups and then the other groups go on and so forth. So yes, there can be side effects in the future. Also there may be. But at the moment, the risk seems to be outweighing Sorry, the benefits seem to be outweighing the risk.
Thank you very much, Doctor.
Thank you very much, Lion Victoria Teixeira from London. Yes, Lion Prabhadar. Please unmute your mic. Yes, yes, Lion Prabhadar.
Doctor, good afternoon, and thank you very much for the informative session. I just want to clarify now, even you do the antigen test today, and you will get this COVID next day. Today it will be negative, and tomorrow I may positive COVID patient. So now there are so many masks available in the market, and people wear helmet when they are riding the bikes just to get went from the police. Like that, there are so many masks available in the market, and and it's not suitable, and so people are just wearing that. And is it necessary to have guidelines or to have some from the health authorities to wear some particular mask? So otherwise, people are just wearing masks and going up and down, and they will affect, and sometimes from there other people will get effect without having proper mask.
Yeah, and okay, so you have asked two questions. One about the PCR and antigen testing. What you said is correct. What you test is correct, because as I mentioned previously, what the test detect is the PCR detect the existence of the RNA in the body. So today it can be negative. Sometimes tomorrow it may be positive when the RNA load is high and adequate to be detected by the RT-PCR. Same goes for the antigen. Only difference is antigen test detect the protein and the RT-PCR detect the RNA. So what you said is correct. That is why doing antigen testing or RT-PCR in a mass scale for everyone is not meaningful. It has to be criterion based, because even when the virus gets into the body, it takes few days to replicate and to get into the level that is detectable from RT-PCR. That window is there, and for antigen also there is a window which is even narrower. So only if you do the test during that time period, you will get a positive result. So what you said is correct. You can be positive today and negative tomorrow. You can be negative today and positive tomorrow. It all depends on the availability of the viral material within your body and the detectability of the viral material within the body. That's why it's very important to do the testing in a criterion-based way. If you have affected, or if you have a contact, or if you have symptoms, then yes, you have to go for testing. But no point of doing testing just to find out whether you have got the disease, because you may not have it today, but by tomorrow you can develop it. Okay, so it's very correct that you have to go for very targeted testing. Otherwise, you'll be just wasting the country's capacity, because there are some private sector hospitals I have seen, they do about 1,000, 2,000 tests per day, but only 1 or 2 get positive. So that means a large amount of unnecessary testing happening. This is not a moment to go for unnecessary testing and waste the valuable resources, because all these testing material are very complex, very expensive, and the availability is very limited. So yes, you are correct. Yeah. Regarding the mask, again my answer is no mask. Some mask is better than no mask, and you have to wear it properly, and you have to clearly cover your nose and mouth properly in a proper way. There are many different kinds of masks that you can use. Yeah, and wearing the mask on the chin doesn't serve any purpose, and it can be risky also, because if some droplets are basically deposited on your shirt or on your neck, that can get deposited on the mask and you can get the disease. So that is not effective, and that can be dangerous. Yeah, idea of wearing the mask is twofold. One is to prevent, if you are infected, to prevent it spreading into some other person. Second idea is, if you if others have it, to stop it getting into you. Now, there is mask called N95, which is said to be 95% of assurance that the viral will be filtered, it won't go in. That is generally meant for the high-risk procedures in the hospital, so on and so forth. There are guidelines actually. What the guidelines do say is, if you are in a high-risk situation, crowded, what we call the aerosol generation, when there is a lot of procedures like nebulization happening in the theaters, okay, or when there are a lot of people talking or singing, that is what we call aerosol generation. A lot of droplets are generated. These are very high risk situations. Those situations, best is to go for N95. Other situations in the hospital, surgical masks are recommended. Now, even for health professionals, it's not recommended to wear N95 all the time. But in high-risk procedures, N95 years. Other procedures like talking to patients in the OPD, surgical mask is fine, and you have to wear it correctly. General public, what is suggested is cloth mask is okay. What I had to say is the chance of you being safe, say someone else's particle getting into you, that safety is less in the cloth mask because the openings are too large. But if you wear a 3-layer cloth mask, what we call 3-ply, then the safety is better. Safety is closer to a surgical mask if you wear a 3-ply. And if you wear it cleanly and properly, you should know how to wear it properly and how to dispose it properly, and when to take it out and how to put it on. So these are the recommendations. Cloth masks are okay because if everyone wears the cloth mask in, that will reduce at least the viral load that is getting into the community. And that will reduce the spread. Okay, so that's my suggestion. Cloth mask is fine, but in high-risk situations, you can go for surgical mask or N95. Regarding the quality assurance, yes, there are many products available in the market. There's no 100% assurance regarding that at the moment, unfortunately. But still, no, some mask is better than no mask.
Thank you,
Governor
Thank you so
Rasika.
much.
Yeah.
Thank you very much,
Good
Lion
evening.
Prabha. Yeah.
Yeah. Good evening, Professor. This is Governor Rasika here. Actually, I'm on the wheel at the moment. So this is just to say thank you to you, but not to answer any question because we got a lot of data inside today in our memory. So no more capacity available to ask questions. Thank you so much. And these are very informative.
Yes, I think because what I have actually told is actually very complex information. Very complex information where not many are aware. I try to simplify it into a language that could be understood by everyone. But this is actually very complex piece of information that not many have understood clearly. That's why there are a lot of misinformation going around.
Exactly. Now, even though now we as Alliance, we are, even though we have a COVID pandemic situation, our leaders join with the Zoom accounts. They are willing to serve the people. That's why we need this kind of information because anyway, we also want to be a safe side because we want to be an example for.
Yeah. So if you want to do something meaningful, focus on the underprivileged, disadvantaged communities because they are the people who are mostly in need, and these are the places where the disease is spreading. So if you want to help to spread the prevention of the epidemic, focus on the underprivileged, so socioeconomically disadvantaged population. Try to work out what are the measures that you can do. Maybe health education, maybe financial support, or maybe say food support, kind of a nutrition support, or even other like say mask donation. Those things can be possible. So my suggestion is, if you want to make a difference, focus on the underprivileged communities.
Thank you so much, Professor. Very informative.
Thank you.
Thank you very much, Governor Dr. Rasikesh Priyantha. Any other questions?
Appreciate.
Anyone wants to ask any question?
And I thank you very much for organizing this valuable session.
Okay, thank you. So we'll wind up the today's webinar since there's no other questions.
Thank you.
We are very much privileged to have you, Professor Indika Karunathilake, the President of the Sri Lanka Medical Association. It's very informative session today, and we wish you very happy birthday also, because Professor's birthday is coming up tomorrow.
All right.
Yeah.
Very happy birthday.
Thank you very much for your participation, and special thanks to Governor Dr. Asikesh Priyantha, first Vice District Governor Roshan Kanchanayapa, and the second Vice District Governor Bennett Gamla, past District Governor Dr. Lasantha Gunawardena, the Cabinet Secretary Lion Ananda Vijayasinghe, Lion Prabha Dharmawardena, Lion Gaya Upasena, Lion Ismat Ahmad, Lion Malavinuan, Lion Mahen Aberatna, who is in the audience now, and Lion Anoma Kurvitarachi, Lion Hyridine, and Lion Victoria Tisera from the 306 C1 district, I think, Lion Shyama Silva, and Lions Club of Colombo Mead City, all the members, and the Royal College Doctors Association and Royal College Leo Club. Thank you very much, Doctor. Thank you for your valuable time. Thank you for the audience. Thank you very much. So we'll wind up the session.
Thank you very
The
much.
video will be uploaded to YouTube. You can subscribe to the channel Talk with Ayesh. You can check it from the tomorrow. Thank you very much. Thank you. Good night.
Good night. Good night. Yes, thanks. Okay. Thanks, doctor.
Thank you. Thank you.
Good night.